Now, there's a few scary stories running through the media about breast implants causing cancer. Is this a myth or is this true? What's your comments on that?
It's basically a myth. There's absolutely never been any evidence to say that breast cancer is caused by breast implants. In fact, the opposite. There's one paper that suggests that actually breast cancer is reduced in incidence if you have breast augmentation. Do I believe that? No. Do I believe the statistic that says it doesn't cause cancer? No. I don't think the appropriate studies will ever be able to show one way or the other whether there are problems. There are all sorts of scares though with implants, and if I've got time, you don't mind, I'll just tell you a little bit about some of the issues. You see, when I was brought up, we had a very soft silicone gel, and that soft silicone gel you can actually see causes collapse. It feels great, or we used to think it was great, but in the human body it basically does that. It's not great. It's an implant that has no shape, no form, and by and large it'll do what it wants, which is usually does that, and it leaks. And there were scares about that leaking. It causes capsular hardening, we know that, but also the scare was, did it cause an autoimmune condition similar to ME? And ME is ladies get tired, lethargic, miserable, and joint pains, arthritis. They get really unwell with that. And then it became pretty clear that there are diseases by association, not necessarily diseases by causation from these implants. In other words, women may well have got that ME-type symptoms without having implants directly. So when you start to look at women with implants and those without, the incidence of this ME was exactly the same. So therefore, when you're looking at women with implants without for cancer, probably the risks are exactly the same. You know, why should an implant that's not in the breast, it's behind, at least another layer behind the breast, why should that cause cancer in an organ that's living in front of it? You know, you're much more likely, if there's a problem with this implant, to have cancer somewhere else. And there's never been any documented evidence to say that women with implants are more likely to have cancer anywhere else. So the liquid silicone story, to me, started the whole, if you like, the philosophy about how safe silicones are. We all don't want that silicone around the body, so the implants started to harden up. And they started to, you know, we get different sizes and shapes and forms and texturing, which is what Patrick was telling us earlier. This is the salt-covered implant, and by salt extraction it leaves the texturing. And this implant is supposed to lock in the body. But you know it doesn't. The vast majority of the times it's allowed to float free. And what you actually get is a layer outside that, the space of which fills with a fluid. Now, we now know that, because of recent data, that 1 in 100,000 women get a late swelling. You talk about decades later, from being very good to suddenly getting a breast twice the size as the other. And that swelling contains a fluid. It could be blood, it could be a sort of transparent liquid, which is basically an exudate or transudate. Now that fluid itself is a bit of a problem. You probably would need to have the implant replaced and the capsule stripped. But of those women investigated, 1 in 100,000 of those could show, apparently, a thing called anaplastic large cell lymphoma. Now that's a type of immune tumour, if you like, that lives around the shell that has the implant in it, in the breast. Now the trouble is that actually occurs naturally without an implant as well. So the actual data is strongly supporting the fact that this didn't cause cancer. The cancer was there because you've got the implant there, we're able to pick it up. So disease by association is what we generally tend to think now as the issue. Now with polyurethane, sorry, we went from these sort of dome-shaped implants to what we call anatomically shaped implants, which were these. And this is an exaggerated example of a teardrop-shaped implant. And these implants often cause problems with regards the top shell bending over, or of rotation, or of twisting. And these implants, when they contract and they fold, they create great big ridges. And if you ever see these that are ruptured, they do create quite a solid jelly type of exudation, if you like, from the rupture of the shell. And it can be quite alarming, but actually that silicone, being cohesive, does tend to stay within the capsule which the body has formed. You do rarely see lymph nodes and glands coming up in the armpit, but it's not that common. Now, I've never seen anybody with lymph nodes, cancer lymph nodes, with silicone in, and that doesn't mean you haven't got breast cancer, but I've never actually seen the two together in one lymph node. And I've looked at lots of people with cancer and lymph nodes that have had implants. Now, if you look again at the polyurethanes, the polyurethanes have this rather furry sort of texture on the outside, and that is well adherent to an implant which underneath is fairly transparent, which is what Patrick was telling you earlier. This implant, they're more or less the same. The layers have been made, and on top of one of these goes the polyurethane. Now, this polyurethane degrades. It doesn't survive forever. It degrades over a period of time, and in my view, the maximum degradation is occurring within the first few years, and then it tails off. By about 10, 15 years, probably virtually all, if not all of that polyurethane is probably gone. Now, this polyurethane was made in a laboratory. It was made from two chemicals to make polyurethane, and then the body then takes that polyurethane and degrades it, but it's not into the two original products. It's made into something else, which actually the body, we don't know what it is. It's made into something which 80% of women will excrete in their urine. And of that product, in a laboratory, one can make another product from that product that's being excreting, which is what we call a thing called 2,4-TDA. Now this 2,4-TDA is the scare story about polyurethane implants, and it's been going around now for the best part of probably 20 years. And it keeps rearing its head, and it comes along whenever one is worried about things about breast implants. We all say that polyurethane is safe, but then we hark back to a thing that the MHRA put out in 2005 saying that this product called 2,4-TDA is released and it can cause cancer. Now, it has never, ever been reported as causing cancer in women, and it's been around for nearly 50 years, as I understand it, polyurethane, in South America and globally, and nobody has ever reported a case of cancer associated with this. The sort of cancer we'd be talking about, presumably, would be some sort of carcinoma of breast, and the incidence of that is 1 in 8 to 1 in 10 women. There's no increased risk of that just because you've got a polyurethane implant in there, having had breast augmentation. If actually you look at the study in urine, the investigation, it's only obtained if you hydrolyse the specimen and you actually cleave off this product 2,4-TDA from what we call an oligomer. And that particular product is made by putting into 6 normal hydrochloric acid and boiling to more than 100 degrees. It's 107 degrees, I believe, the study originally that came out. So whatever you're doing, you're cleaving off part of the long chain molecule into a small molecule, which in the laboratory is 2,4-TDA, which apparently in the laboratory, in a certain form of strain of rat, will make some form of cancer in that rat. There has never, ever been a reported case of 2,4-TDA in women causing cancer. Now we've got to put that into perspective because, as I said, 80% of women that have got these implants in will excrete it in their urine over a period of 10 years, probably maximal the peak is in the first few years before it disappears. So there's also 13% of women who don't have polyurethane implants that actually have 2,4-TDA, which you can make from their urine. And the story there is probably around environmental polypropylene type products which we ingest. And that means we go to a food store and we buy something that's got polythene on it, we hydrolyse it, and we do know that you can actually ingest 2,4-TDA. If you've actually got it and made it, you've hydrolysed it, you drink it or you eat it, it goes straight into your bloodstream and into your urine and you pee it out. So 13% of women, and probably men, but it's never been done, probably have 2,4-TDA in their urine naturally by from the environment. Has that ever been caused or incriminated as causing cancer? Not in my opinion. I don't believe I have any evidence for it at all. So one starts to feel that 2,4-TDA may be a bit of a problem which we haven't really got the accurate data on. And I think it's a bit rich for the MHRA personally to come out and say it causes or could cause cancer, therefore don't use this implant, when we know in practical terms it has never caused cancer after 50 years of experience, 40 years to 50 years of experience, and therefore it needs pretty urgent review, clarification. Therefore the public is fully aware that the risks, if they are there, are less than 1 in a million of even having that product to cause cancer. So in my view, there's a lot of misinformation that needs to be made more accurately and corrected.
So Professor Frome, in summary, is there an estimated risk of cancer associated with breast implants?
There are published figures that show the estimated risk is less than 1 in a million, which is probably below the radar of clinical significance.
So very, very low.
Yes.
I think we've covered a lot in this discussion, and I'm hoping our viewers have taken something away from this. I mean, what would be to sum some of these points up?
Can I add one other thing?
Yeah, of course you can.
There's always the other breast.
Right, okay.
And not only the screening and follow-up and everything else, but actually the other breast is never going to be the same. Whichever reconstruction you do, never going to be the same as the other side. And often you have to consider whether or not you need an uplift, a reduction. It's often an opportunity for the lady to get a better shape and form on the other breast. And symmetry is really what plastic surgeons are very well capable of getting. Often it involves putting an implant in the other side just to give us a bit of fullness. Now, which implant would you then choose? Bearing in mind there are complications from augmentation on somebody that's now got a breast that was normal, you're trying to make comparable with the other side. So again, it becomes, to me, a no-brainer. You've got to use an implant. Which is the best implant? Well, it's got to be a polyurethane. So if you've got a polyurethane on one side, well, why didn't you put one in the other side when you had the opportunity? It's something which isn't been made clear to the public, the ladies, the associations, and even surgeons. It's a very macho thing to move a flap. You know, as a surgeon, it's a lovely thing to do, but you've often got to think that is that the right thing to do in all cases? And I would argue the opposite. I would say it's actually not the right thing to consider as the primary option. It's something that has a place, but it's not the panacea. And I would, you know, as a member of my family, the first thing I would say, well, let's see an implant, see how you get on. If you don't like it, then we can go for the bigger surgery.